I have the pleasure of introducing Erin Rosales. She's a very accomplished student with her associates in the natural science and biology and her bachelor's in human biology and global health this December 2020. Her dream career is becoming a primary care pediatric nurse practitioner, and when she's not tirelessly advocating for communities, she's an avid concert goer. And so the title of her presentation is called Health Disparities in Pediatric Orthopedic Surgical Care in the U.S., a Scoping Review.
Awesome. Thanks so much for the introduction, Vivian. So this summer I had the opportunity to research health disparities in pediatric orthopedic surgical care in the United States with my mentor, Dr. Sabatini, and her medical student, Tyler Kelly. So health disparities, what are they? Health disparities are defined as the differences in the incidence, prevalence, mortality, and burden of diseases and other adverse health conditions that exist among specific population groups in the United States. These differences, which are social determinants that impact health, include race, ethnicity, gender, socioeconomic status, religion, geographical location, and disability. This can impact post-operative outcomes, increase morbidity and mortality, increase the length of stay for patients, result in prolonged rehabilitation, and overall lower quality of life for pediatric surgical patients. So therefore, this summer, I had the opportunity to engage with hundreds of articles that focus on this very important topic with Dr. Sabatini and Tyler by conducting a scoping review of the available literature. So what is a scoping review? A scoping review is one of 14 review methodologies to conduct evidence-based reviews. Here's a diagram that I created of the research process for a scoping review. So step one, we developed a research question being what health disparities exist within pediatric orthopedic surgical care in the United States. Two, we set eligibility criteria, such as we're only interested in primary resources and the type of surgical specialty, which is orthopedics. And then three, we identified these search terms here. And these search terms encompass ideas such as pediatrics, orthopedics, trauma, fractures, disparities, health equity, and the United States. We consulted our search terms with a clinical librarian to refine our methods and search terms for searching our databases, which is in step 5. So we put these terms into 3 databases, which were Embase, PubMed, and Web of Science, which yielded about 898 results. We then used a systematic review software, Distiller SR, to upload references and begin our scoping review process at step 6. So this is where we are right now in our scoping review. We have just reviewed 898 title and abstracts, and right now we're going through a conflict review in which our team discusses any disagreements for the inclusion or exclusion of articles. 3 levels are included in this process so that as we move along in it, fewer and fewer articles will be included in the level 2 full text review and level 3 data extraction and secondary review. And ultimately, we will compile the available literature and data to create a manuscript. So future directions for our project include to complete the scoping review and publish a manuscript which summarizes our findings. And this scoping review will better equip pediatric orthopedic surgeons to advocate for their patients and identify the knowledge gaps in the available literature to guide our future research. And finally, a big thank you to Dr. Sabatini, Tyler Kelly, the SSRP leadership team, and our cohort for their continued support and guidance. Thank you.
Well done. All right, questions for Erin?
You gave a really, really great presentation, Erin. I was just wondering, what type of health disparities have you kind of identified from your abstract so far?
Yeah, so the various ones that we've come across during our abstract include geographical locations such as like rural health. And one thing that I found interesting was, I guess, there are, during our title and abstract review, there have been like a wide span of articles, everything from the prevalence of ATV injuries versus bicycle injuries in pediatrics, all the way to opioid prescription and the use of trauma and emergency care. So there's a wide array of disparities that do exist in pediatric orthopedics. And I was very surprised to learn that within our field itself of orthopedics, there is almost 900 articles, and that's not even like all surgical care, it's just within a specific specialty.
That was a wonderful presentation, Erin. In the hundreds of like literature that you reviewed, like what's the most surprising thing that or like thing that jumped at you when you read through these disparities?
So far, I think that it's just what I've been surprised about is the wide range of articles that there are. Like, for example, there was one very specific article on the looking at the disparities for ultra Orthodox Jews in New York. So that was a very specific population of people. And I think just the various disparities that do exist, you know, that you don't really think about, like religion, for example.
So just quickly, how do you envision summarizing 900 articles, or do you anticipate that you'll be excluding a whole bunch of them before you get to your summary?
Right. So I think so far we've reviewed about 900, and I don't know the exact number right now, but it is, I would say, hundreds of articles less. Because some of the, using our software, some of the words that are pulled up include, but sometimes they're just focused on geriatric patients. So sometimes the software doesn't do it, or our search terms don't really pick out pediatric as well. Or sometimes it'd be like the search terms that we identified include patients older than 17 or 18, and these individuals are skeletally mature, so we aren't really including them in our study.
Excellent.
We expect, I don't know how many articles at the end, but definitely a lot fewer than the 900. Yeah.